Sagar Khadaga, who is Associate Professor in Department of Medicine. So I'll request him to carry on other proceedings from here. Uh, we have a team of adjudicators who are sitting here. I'll quickly introduce Dr. Pratyusha from AIIMS Mangalagiri, Dr. Anupama from AIIMS Bhubaneswar, Dr. Jasketan from AIIMS Raipur, and Dr. Manoj Sarkar from AIIMS Devgar. So they were also regional coordinators for some of the regions. So they are the adjudicators. I think in cases of any discrepancy or any appeals, we can solve it. And I'll now hand over to Dr. Sagar to tell other rules and before we
Thanks, Dr. Rajneesh, and congratulations to the winners. We will be moving. Actually, it was the exam for the faculty also. Because you people have qualified for the national quiz. You are better than us. That's how the question will be. Fine. So, we will have 12 rounds. We'll start with Group A. You want something? We'll start with Group A, and then it will move clockwise. So, A, B, C, D, E, F. And on round 7, again it will start with Group A, and this time it will move anti-clockwise. A, F, E, D, C, B. Okay? So, 12 rounds. Each round will have some separate instructions which will know them at that particular round. Basically, in among the 10 rounds, the question will be passed to the immediately either the clockwise or the anti-clockwise, and we will go on. I mean, if somebody is not able to speak, if it was a direct question to D and we are moving clockwise, D then will be passed to E, to F, and it will move on till everybody are exhausted. Fine? So, and for passing 5 seconds only, and for direct question it will be 20 seconds before I stop or after I stop. Many a time I will read the questions and there will be some lengthy questions. I will give some important clues, but you have to take a clue from the questions directly. Got it? Fine?
if nobody can answer, it will go to the
Nobody can answer, it will go to audience. Fine. But we don't have such chocolates
we'll get chocolate.
for the audience.
Write down the names. Who gets
Okay. Okay. Any each round it will be discussed. Basically 10 and 5. That's how it will move in most of the rounds. But in each round there is a special marking patterns also. So the first round is called as the history of medicine. One image will be there, and there will be some clue at the side of the image, particularly the year or date of that particular image, and you have to figure out what that image speaks. The decision of the adjudicators are final. Clear? Any controversy, whatever they will tell, it will be final. Clear? Rules. First question to team A, then we will move clockwise. 20 seconds for direct question. Who is taking care of time? So you have to be a bit louder. Time up so that immediately the next person can answer. 5 seconds for a pass question. The scoring will be 10 and 5. So 10 for direct and 5 for pass questions. Okay? No negative mark. No negative mark. Okay? That is a good part. Okay? Fine. Let's start. The question goes to team A. Name the substance which is being administered to this particular child.
Smallpox vaccine.
Very good. Team A, full marks to team A, 10 marks. So it was a variola lesion, and the fluid from the cowpox actually was transmitted to, was given to a Edward Jenner. Now the direct question to team B. Name the substance which was being administered to this patient. Teams. Blood transfusion. Okay. Okay. Fine. Thank you. So 5 marks for team C. So James London's blood transfusion is being team B. Team B itself answer. Sorry. It was not part. So team B 10 marks. Okay. Direct question to team C. Name the substance which is being administered to this particular patient. Can you name it? No. Next. Ether. Good. So 5 marks to team D. So it was ether. William T.G. Morton is demonstrating the use of ether in 1846. Now the direct question to team B. Name the substance which is being administered to this child. No. Next. D. Next. F. Teammate. No. B. C. Take a chance. Okay. So this is actually the first time the rabies vaccine was used by Louis Pasteur way back in 1885. Was he the first person to use rabies vaccine? Get more about it. He was not the first person, but he proved it in a public gathering. But and it was a first scientific literature about rabies vaccine. Fine. So next question is a direct question to team E. Name the disease of the patient Hedge. No. Team F. No. Team A.
Korea.
No. Team B. Hysteria. Good. Loud class for team B. So these are the conversion reactions last hysteria, which was identified by, or in fact the students are being, are there to demonstrate what is about hysteria. So Charco hysteria or conversion reaction where we can disease. Is also there. You are writing. Fine. We are moving to team F. Direct question to team F. Name the substance this person is trying to see. No, with this much amount of I can't give you. Team A.
Diphtheria.
Team B. Very good. So he is allocated of living, looking at a culture plate and looking at the correlation inputted by Team B. Okay, so with this we move to round 2, which is called as the Cellulose round. Okay. So you have to be really careful enough to look at the clue and then try to figure out. Questions will be from team B and we'll move clockwise from there. 20 seconds for direct question, important, no pass. So we are not going to pass. This will be a three-part question. If you can answer at part 1 only, you will be awarded 20. If after the first clue, 10, and after the second clue, it will be 5 marks. Okay? 20, 10, 5, no passing. Clear? So we are moving to team B. Name the disease. Rebellion by one's own army and mutinous spread wide. Citizens harmed as armies flight. Debris clog the train. Reds and proteins break free. Time starts now. Others 25, 5. 20 seconds, 5 seconds, 5. First, you want first clue. Okay. Water everywhere, but losing drugs to drink. No. Could need powerful allies to fight many battles, but will war be old? Time up. So we are dealing with autoimmune glomerulonephritis. So autoimmune, rebellion, water everywhere, edema, and will the fight be completed ever? Okay? So no marks to team B. Now we are moving to team C. Fine? Team C, ready? Oh, sorry. I forgot. Next time, audience. Sorry. Team C, name the disease. An error at inception with faulty vehicle that cannot squeeze through narrow lane. Very good. Like a round moon that assumes a descent to become round again. Life is a crisis, and we are 20 marks. Fine. Now the direct question to team D. A barrier that checks and lets all go now has a new autocrat. Some are able to pass through, but others don't. First clue. What was regular now varies with a pattern. Second clue, with a risk that autocrat may block them all. Audience? Yes, madam. Nearer to that, anybody else? A better response? Second degree heavy block. Okay? Nobody from audience. Okay, now the direct question goes to team E. Name the disease. There were many, but now just a few. An extermination of sorts that doesn't bother the other two. Clue. Blood is soft and neither does it grow. Second clue. Blood is led to flow. Audience, get ready. Yeah, anybody want to take it? Nobody want to take it?
Thrombocytopenia. ITP.
Idiopathic thrombocytopenia. Can you just identify yourself?
Team Kolkata.
Team Kolkata.
IPG में Kolkata.
Name, your name.
Doctor Shankar.
Okay, so now the direct question to team F. Ready? Silently, it enters to create a fiery storm. Its footprints, however, takes a black form. First clue, a bug it is, though quite small. No. Second clue, dog cycle scene and end game is on. Rickettsial disease, fine. Okay, thank you. But the scrub typers, we are talking about team F. 5 months. Fine. Okay, now we are moving to team A. Okay, ready? Fine. Name the disease. Use sleep and deceive to multiply for almost half a year, and out of the blue, white turned yellow. Mic is on, you can switch it off.
Raynaud disease,
No. Powerhouse was blown and pieces flew away.
Aplastic anemia.
No. A fortnight, order was restored, but invader may stay for a more sinister kill. Anybody from audience?
Malaria.
Viral hepatitis. Good. To be more specific, acute or chronic?
Chronic hepatitis.
Fine. Good. So it presented as acute viral hepatitis, but probably likely because of B or C. Okay, so now the direct question will go to team B. Ready? Somebody told the hepatitis.
Both, I think.
But there is no passing for team C.
Audience.
Audience.
This team and I think that team.
What's your name?
Manipal team and Kolkata.
Anirban. Okay, so we are moving to team B. Direct question. No, I think it was over. So now we are moving to round 3. You will be given various phenotypes of that particular disease, and you have to respond to that. Again, this will be a pass question, and obviously you will get 5 seconds for pass and direct 20 seconds. Okay. So question goes to team C. C, D, E, F, and in that order. 10 and 5 marks. Clear? Team C. The asthma phenotype. 18-year-old person has bronchial asthma for 7 years now. She is on maintenance inhalation corticosteroid and LABA, and despite being addressed, she had 4 exacerbations that required hospitalization in last year. Her sputum has 5% eosinophil, and her AEC absolute eosinophil count was around 350. The following are correct statements regarding her asthma. You have to figure out A, B, C, D. Option 1 is correct, 2 and 3 are correct, 1, 3, 4 are correct, and option 4 is correct. Time starts now. D answer. Option 4 is correct. Oh, it was a pass question. It was supposed to be passed. Round 3 was a pass. So how to deal with it now? No passing? No passing. So the whole round will not be passed. So option 1, 3 and 4 are correct. Option 2 was airway has type 2 inflammation. Fine. So it is no more a passing round. Here, so we are moving to team D, MDS prognosis. Regarding revised international prognostic scoring system, IPSSR, for myelodysplastic syndrome, MDS, the following is correct. Higher the score, what is prognosis? Presence of 11q deletion cytogenetics as high score, more medullary blast, low hemoglobin have a low score, lower platelet or low absolute neutrophil count have a poor poorer outcome. Team D.
C.
C. It was B. Option 1 and 4 are correct. You can look at the response. Fine. So we are moving to team E regarding dengue. 16-year-old student who has fever for 8 days was investigated. The test results were negative for malaria. Dengue NS1 and IgM were both negative, but dengue IgG was positive. The student had no history of fever in the last 5 years. In this context, the following are correct statement in context of this test report. Dengue is unlikely to be responsible for this fever. Dengue IgM should again be repeated after 7 days. Less than 30% of dengue infections are asymptomatic. Plaque reduction utilization as APRNT is gold standard for dengue serology. Your time starts now. Option C. C are correct. So you are getting 10 marks. Group E. Fine. Group E. Third round. 20 marks. Right, 10 marks. Okay. Now we are moving to team F regarding myeloproliferation. 36-year-old banker had malleus and on examination was detected to have an LR spleen. He has hemoglobin of 19, PLC 10,200, platelet 4,25,000. The following are correct statements in context of this disease. This disease is Philadelphia negative and TKI have no role. The underlying pathophysiology is inhibited by JAK-STAR. In presence of JAK2T61/7F mutation, low serum EPO bone marrow is not needed for diagnosis. Myelofibrosis is a complication present in about 80% of the patients at the time of initial diagnosis. Direct question to team F. Option B. The option B is correct and you are awarded 10 marks. B. F. F. Fine. Now we are moving to team A about heart failure trial. Identify the correct pair of heart failure trial. I'm not going to read.
C option.
C option. Option C is correct. Team A 10 marks. Fine. We are moving to team multiple pain. A 60-year-old person has developed pain over his hips and shoulders. All other tests, blood count, chemistry, screening for HIV, hepatitis B were negative. His CRP and ESR are both elevated. True statement about this disease condition are: circulating immune complex are diagnostic in this disease. Therapeutic response to glucocorticoids is poor. When corticosteroids are tapered, relapses are likely in 40 to 60% of instances. Tocilizumab is an emerging therapy in its management. Option C. C is correct. We are talking about polymyalgia treatment. Fine. So 10 marks to team B. Done. Total scores at the end of this round are mic designated here, or it is okay? You can be louder a bit. Take a mic.
At the end of the third round, Team A has total score of 20. Team A.
Team A 20.
Team A has 20. Team B has 30. Team C has 20. Team F has 15. Team E 10. Team D 5.
Team
Sorry.
top one. 30.
30. Team B is leading with 30. And second, Team A and C.
Team B 30 marks.
Ah.
Fine. So we are moving to the round of various trials. You know, important trials that occurred over last couple of decades or so. So we are moving into the trial round. So we'll start with team D and we'll move to clockwise E, F, A, B, C. Okay? 20 seconds and we'll try to pass it out. No, it is again no pass. Okay? Scoring only direct, 10 for correct part 1 answer and 20 for correct part 2 answer. So mind it, the first, there is less, means if you can name the trial, less mark, but you have to explain to some extent at least. You have to come closer to that. Huh? I know there may be some controversy, so whatever our external faculty will say, we'll move on. No passing. Direct question to team D. Guess the trial. Relay, very good. Would you like to wait? Wait. It's a trial, drug versus drug. What to do? 10 for sure. They told only about warfarin, so can't give. Okay. Going to the audience now. No. So they have identified the part 1. War versus? Okay, you told the brand name. Okay. No, newer anticoagulant. You should have identified the name of the drug. He told Nova.
Please be loud, we are not able to.
Full marks. Okay, so 10 plus 20, 30. 30 marks to team D.
Please be loud, we are not able to hear you.
Okay, so dabigatran versus warfarin non-inferior trial. High dose of dabigatran is superior. Round 4. So high dose of dabigatran is superior to warfarin in the prevention of strokes in patients with atrial fibrillation, while low dose of dabigatran is non-inferior to warfarin in preventing strokes in this population. Fine. Now we are moving to team E. Get the trial. No, so as the first part was wrong, so he will not move into part 2. Anybody from the audience, which trial it is? The first part is wrong. They can move, still move to part 2? They won't get 10 points. Okay. But if they answer the still they will get 20 marks. Okay, so we'll move to part 2. It was about hot trial. No. Audience.
Hypertension optimal treatment, BBP should be less than 80 is better clinical, no clinical outcomes.
Good. So it was about diabetes. $20 marks to audience. Okay, we are moving to team F. Get the trial. Team F.
This picture is from your state.
River trial. Can you elaborate? Fine. So again, 20 marks. Early goal directed therapy in severe sepsis to 20 marks to team F.
Anyway, can you name these two rivers?
Janskar and one more.
Indus and Ganga.
Indus and Jan. So we are moving to team A. Get the trial. No, I would like to take a clue from this consensus trial. What is all about?
Regarding heart failure, HFpEF.
No. Anybody from audience? Okay. The really smart guys are sitting in the audience. Huh? So,
I hope you are not googling it.
It's a case. Oh, already I'm.
oh, already there. Okay. LNAC will reduce the mortality or remodeling in severe heart failure in 1987. You can't just tell heart failure. Huh? You, fine. Now we are moving to team B. Get the trial? Print trial. Very good.
Can you speak in the mic?
What is all about?
Use your mind and
No. Audience?
Diabetic patient keeping the SBP less than 110 is a much greater CV benefits than 1%.
Good.
10 marks for team.
10 marks for team
B.
B. Sprint. Now we are moving to team C. Guess the trial? Go negative, take a chance. Huh? So this was paradigm heart failure trial. What it is all about? Now you can mention.
Artesian FS.
So we'll give 20 marks to team. Team D. Direct question to team D. Guess the trial. All had trial. Very good. Can you explain about it? Let's move. Diuretics is the first line of antihypertensive therapy. Again, the team also told congestive cardiac failure. We have to identify the drug. All these are tried. It started from team Lee. So was there a extra question? Yes.
You can go back and see.
Started with team D. Okay, then it was no marks to team D. we are moving to extra question. Fine. Now it will be important round about the therapeutic distance. Huh? Round 5. We will start with team E and it will go clockwise from F, A, B, C, D. It's fine. 20 seconds for a direct question and 5 seconds for past questions to the next team. 10 seconds for direct and 5 for pass. Okay. So we'll move to team E. A 65-year-old person has ischemic heart disease. He had SCS 1 year ago, which was treated with thrombolysis followed by PTCA, which he doesn't have any cardiac symptoms now. And in a routine evaluation, his echocardiography suggested RWMA with LVEF 55 as per 2023 AHA guideline on chronic coronary disease. Correct statement is which among the following? B. The question was correct. Pass. Option C.
Sir, MC.
Huh?
Hold on, sir.
Huh.
If we pass like this,
Then it will be
someone will answer it.
difficult. So no passing.
Go pass.
No pass. Fine. Okay, the answer was B. 1 and 2. You answered one B. Fine. Then we'll give full marks to 10 marks to
No pass.
no pass. Fine. 10 marks to team E. So option B was correct. 1 and 2 are correct. Okay, we are moving to team F. About basic life support, a 35-year-old person who had gone for a swim in a lake is drowning. The patient is drowning. 2 first responders notice this and take a motorboat and are able to pull him out of the water onto the boat. The victim is pulseless. As per 2023 ILCOA guideline, the correct statements are.
Option D.
Option D. Option D is correct. And team F is getting 10 marks. Okay. Now we are moving to team A. About ACLS, a 35-year-old person had witnessed out of hospital cardiac arrest. Immediate layperson CPR was initiated and a decision to transport the victim to hospital was taken while CPR was ongoing. Patient has a shockable rhythm but remains in cardiac arrest despite 3 seconds of defibrillation. The hospital team is contemplating the use of ECPR, extracorporeal cardiopulmonary resuscitation, as per 2023 ILCOA guideline. Correct statement is which?
Option C.
Option A is correct. Rest all are false. Despite low certainty of benefit, extracorporeal cardiopulmonary resuscitation benefit should be given to the patient. Fine. So we are moving to team B. Arterial fibrillation. A 45-year-old person presented with intermittent palpitation. His clinical examination and previous echocardiography is consistent with recurrent paroxysmal arterial tachycardia, arterial fibrillation. Echo suggests non-valvular AF with a moderately reduced LVEF based on the AHACS arterial fibrillation 2023 guideline. Correct statement is which one?
C.
Option
C.
Option C is correct, so they are getting 10 marks. Team B,
B10.
B10.
Team B10.
So now we are moving to team C. Vaccines in immunocompromised group. A 54-year-old lady with rheumatoid arthritis on adalimumab wants to go on a vacation to Kenya. She needs a yellow fever vaccination, which would be administered at least 2 weeks before her planned vacation. Which of the following statements about vaccination in immunocompromised group are true? A is true and this is incorrect. Both 1 and 4 are correct. Herpes zoster vaccine can also be given to the immunosuppressed. Now the question goes to team B about drug-induced neutropenia. A 65-year-old lady who has paranoid schizophrenia is on oral benzodiazepine, haloperidol, and risperidol. Since she developed tremors and difficulty in walking, haloperidol was stopped. She was initiated on clozapine. 6 weeks later, she developed fever, sore throat, and tachycardia. True statement about her condition 6 weeks after onset of clozapine.
Option C.
Option C is incorrect. Option D is correct. That is 1 and 4 are correct. Clozapine should be started on a low dose and gradually escalated, and it should get drop T and CRP levels measured to identify the about IDN and myocarditis. Myocarditis are actually clozapine. We are moving to the clinical images round, round 6. So we are moving to
After round 6, we'll
we will have a total. So the direct question to team F, we will have a person round in this. Also, the questions will be lengthy, so be faster in interpretation. Marks pattern is same, 10 and 5. Okay. In a 13-year-old female presenting with anemia and body pains, what is the most likely diagnosis? Team F, osteopetrosis. A big round of applause to team F. Fine. Now moving to team A. 60-year-old male presents with sudden onset severe headache, vision loss. Look at the image below and identify the diagnosis.
Pituitary macroadenoma.
No. Pituitary apoplexy. Team B gets full mark. More blood flow to the pituitary. 5 marks to team B. Team B, 5 marks. Now, direct question to team B. 43-year-old female having CKD hemodialysis presented, CKD and on hemodialysis presented with a jaw swelling. Identify the lesion and the likely etiology. Name of the disease. Jaw tumor. We wanted to name about osteoitis fibrosis cystica. It could have been
He told the answer.
they told. I think we could give them.
You have to give
Fine. Team C. Team C. Fine. Team C 10 marks. Team B 10 marks. They told hyperparathyroidism. Fine. So next question is to team C. 16-year-old male presents with hotness of oil. Identify the abnormality. Team D. Time gone. 5 seconds. Lingual thyroid. They just came with the buzzer. Let's give. Fine. So team D. Team D is getting 5 marks. D is 5. Now we are moving to the direct question to team D. 18-year-old female can write high pen and inability to be awake. Identify the abnormality on radiograph and suggest likely diagnosis. SEFP. Student capital femoral epiphyseal. No. Pass to team E. No. Pass to team F. Pass to team A. Pass to team B. So this is actually osteomalacia and this was a pseudo fracture. So marks to team B. 5 marks to team B. Okay. Now the direct question is to team E. 55-year-old man with factor 8 and 5 deficiency presented with weight loss and progressive darkening of the skin. Identify the abnormality on the imaging and suggest the diagnosis. F. Adrenal infarction. Okay, I think we should give them. Fine. So team F will get 5 marks. So this is primary adrenal insufficiency, bilateral adrenal calcification after thrombosis. Fine. Now we are moving to round 6. Let's try to figure out the mark score.
At the end of the round 6, Team A total score is 20. Team B total. Total. Team A is 20. Team B is 70. Team C is 40. Team D is 40. Team E is 20. Team F is 60. Sir, Nagpur, like Team B. Nagpur at 70. Next Team F at 60. And next is 40 from Team D and Team C. And Team A here.
So, in the halfway mark, congratulations to team B and team F. Okay, there is plenty of time. You can still recover. From here on, we will pass the questions to in anti-clockwise. Fine, F to E to D, B, and in that way. And this round is called as scores round. So there will be, you have to identify, we are talking about which score. Okay. First question to team A and then we will move to F and all. 20 seconds for direct questions and 5 seconds for past questions. 10 and 5 again, marking. Clear? So direct questions to team A. Identify what is the score we are talking about.
Merit score.
Merit score. 10 marks to team A. Team F, identify the score we are talking about. Very good. Good. 10 marks to team F. Direct question to team E. Identify the score. A, B, C, D, 2. Very good. So 10 marks to team E. Direct question to team D. Identify the score we are talking about.
Rocker score.
Okay. So team D 10 marks. Direct question to team C. Identify the score.
Part 65.
God, 65. Lucky guy. Okay. Team B. Identify the score. Fine. So everybody scored. So the examiner was good. Fine. So now we'll move to a relatively difficult round about new drug. Again, lengthy question. So be attentive, careful, drink a sip of water and take a deep breath and answer. Okay. So we'll start with team F and we will not pass this one. So team F and then we will move to EDCBA. So there is no passing. 10 marks directly. Fine. Ready? Direct question to team F. Asthma and biology. 18-year-old person has bronchial asthma for 7 years now. She was on maintenance ICS and LABA, and despite being adherent, she has had 4 exacerbations that required hospitalization in last year. Now she is also on oral corticosteroids. Her sputum has 5% eosinophil and AEC was 350. The following are correct statements regarding her further management. Option D is incorrect. 1 and 4 are correct. So no mark to team F. Fine. Now this will be a direct question to team E. This is about new lipid lowering drug. Alterations in PCSK9 pathway is a novel mechanism to reduce lipid levels. True statement about the drug that act on this pathway are. We are talking about true statement.
Option A.
Option A 1, 2, 3 are correct. Give them a big round. Team E. Team E, 10 marks. Fine. Now we are moving to Team D. This is about new anti-cancer drug. ICI, immune checkpoint inhibitors, are a drug class with emerging anti-cancer drugs. Two statements about drugs and mechanism for this pathway are: PD-1 is a checkpoint protein on cancer cells and PD-L1 is a ligand on T cell. You can read it about. Option A is incorrect. Option 3 is correct. That is A, 1, 2 and 4 are incorrect and option 3 is only correct. So D is correct. Now the direct question to team C, new antiviral drug class. Oral small molecules antiviral for antiviral drugs for COVID-19 infection has emerged as a distinct class. True statement about the drugs in this category are team C. Option C is incorrect. 1, 3, and 4 are correct. Fine. We are moving to team D, new antihypertension drug class. ASI, aldosterone synthase inhibitors, are a new drug class. True statements about these drugs are. Option C is correct. 10 marks to team B. Now the direct question to team A, new anti-obesity drug class, GLP-1 RA, are a new drug class. True statement about these drugs / mechanism in this category are. So, they were 1 second delay. Would you like to give or not? You will give 10 marks to team A. Fine. I think we completed the round. Now this round is called as the signals round. So there are some signals on the surface. Basically, it's easy, fairly simple and quick. We will start with team E, and now we will move again anti-clockwise from TCBA BAF. Passing is okay, or we will not pass?
If it has options, we will not pass.
No options are there.
If options are not there, then we can pass.
We can pass? Okay. Let's pass. 10 and 5 with direct question to team E. WPW. 5 marks to team D. 5 marks to team D. Okay. Next question to team D. Find the key abnormality in favor of AMI. Full marks to team D. Team C. Find the abnormality.
Middle branch block with LED. 5. Left middle branch block with LED.
Fine. So full marks to team C. Left bundle branch block white square complex. Fine. Team C. Team B. Find the key abnormality. Short sets. First sets. 1 second. Team B. Team A. Find the key abnormality. Arterial flutter. Full marks to team A. 10 marks. Team F. On to team E. D. Pericarditis. So 5 marks to team D. 5 marks to team D. Now we are moving into round 10. Lengthy, complicated, you have to be smart enough. There will be something, the important figures will be in bold. So you have to look at, I will just read the question and you have to guess the answer. There is no ABCD. No, there is no. Hey, it is multiple choice. If it is multiple choice, then don't. It was not multiple choice. That is why it will go on. Okay, so there is nothing. We'll start with team D. Identify the disease. Familial hypercholesteremia, full marks to team D, 10 marks to team D. Round 10. Fine. Next question is to team C. 18-year-old boy who presented with bilateral flank pain and increased thirst. Identify the diagnosis based on the following results. Full marks to team C. Nephrogenic diabetic. Team B, 10-year-old male who recently diagnosed with acute lymphoblastic leukemia presented with the following parameters given below. He was started on steroids and a drug for tumor lysis syndrome. Identify this drug. Identify the drug causing tumor lysis syndrome and the subsequent issues. You can look at the important highlighted drugs. Drug use. Very good. Full marks to team B. Fine. Now we are moving to team A. 20-year-old woman presents with 24 hours of bruising and icteric sclera. The patient has a sister and aunt who died of acute kidney failure. She has had an unremarkable past medical history and is only taking an OCP. She feels well, BP 110/70, pulse 98, temperature 100. Physical examination is only significant for icteric sclera, fatigue on the lower extremities and several bruises on the forearms that are over 2 centimeters. Lab studies is below.
Eculizumab.
You have to identify the drug use. Fine. So full marks to team A, eculizumab. Team F, 4-year-old child is evaluated in the clinic for a possible bleeding disorder. He bruises spontaneously and has experienced recurrent epistaxis and digital bleeding since birth. He was last evaluated in the emergency room for an episode of epistaxis, requiring admission and PRBC transfusion. His parents are distant cousins. The following test is performed. Name the identify the disease condition. Clear? Von Willebrand factor assay for von Willebrand disease. No. Pass to team. No, it will go anti-clockwise. Ristocetin simulation test.
But not yet.
No. Okay, next. In B. Good. So platelet aggregation trace for fine. So team C gets 5 marks. It's pass. Direct question to team A. 25, team E. 25-year-old male noted to have macrocytic anemia. On examination, he is noted to be short stature, but without any other abnormality. He has no rash or leukoplakia. His finger and toenails appear normal. He has no family history of anemia. Both his parents and siblings are in good health. Workup including iron, B12, TSS, sticks are all within normal limits. His bone marrow exam, however, shows dysplasia with monosomy 7, consistent with MDS. The following test was done. Name the test. Stereotyping? No. Okay. A D. Stress hydrogen. Pass to C. G binding. Okay, I would like to give chromosomal breakage analysis for G binding. Fine. So 5 marks to team C. Now the direct question. I think we completed the round 10. This round is called RRR. In fact, we have got two R only. Total score at this point of time. 10 rounds are completed. We want the total scores now. Take it. What are the total scores? You have to calculate. You write fast. 11 पे लिख दो पहले. Then 11 के ये में आप.
Team A 60, Team B 110, Team C 80, Team D 75, Team E 40, Team F 70. Sir.
Team B is leading consistently also. This round is about the round of röntgenography or X-ray. Sometimes there will be a additional clue also, so you have to figure out and identify the disease. This is again a passing round, so make sure you answer correctly. Fine. There will be two parts of the disease. There will be two questions to it. So if you answer any one, the question will not be passed to other, or we should pass. There are two parts.
If only they are answering on, then
If the first part is unanswered, then we will pass. Okay, fine. We'll move to direct question to team C. 54-year-old gentleman was brought to the emergency room with epigastric pain for last 4 years. He takes occasional alcohol with intermittent binge drinking. ECG and X-ray test are provided 0. Prop T was negative. Mention the gross defect in the image and identify the disease.
Air and diaphragm pneumoperitoneum.
Okay, good. Pneumoperitoneum, identify the disease. What will you mention? Fine. Okay, perforation. Good. So full marks to team C. Next question to team A. Team B. 32-year-old lady presented with intermittent diarrhea for last 2 years. She remembers 3 or 4 times of blood mixed stool during this period. As per advice of a private practitioner, she has stopped taking Queen products. She has not passed to last 2 days and presented with pain abdomen. Identify the gross defect. Toxic megacolon. Guess the disease. Toxic megacolon occurs in ulcerative colitis. Fine. So 10 marks to team B. Team A, 45-year-old male, alcoholic for past 20 years, 60 to 90 ml of alcohol per day, presented with documented fever for last 10 days. Fever for 10 days, THC was 11,200. RFT and LFT was normal, blood CS didn't yield anything, and he is on tablet cefixime for last 7 days now without any improvement. Identify the gross defect and get the disease. Question passed to team. Clockwise नहीं anti-clockwise है ना? Team B. Anti-clockwise. A के बाद B. हाँ A के बाद है. ठीक है. हाँ. क्या है? Team E. D. Difficult. C. B. Team B. No, there's a tenting of diaphragm. We are talking about alcoholic fever for last 10 days. We are talking about amebic liver disease. Team F, 56-year-old male presented with fever and cough for last week or so. He has a recent history of travel yatra to the Kedarnath. He had a history of urosepsis in last month and recovered after 10 days of hospitalization. Identify the gross defect in the X-ray and guess the disease. Team F. No. Air fluid cavity in right middle jaw. Air filled cavity. Okay, you have identified the gross defect. Now, which organism it is? No. So it's a pneumococcal basically. You have identified it correctly, but we are talking about staph aureus pneumonia in a healthcare associated setting. So 5 marks to team F. Direct question to team E. 42-year-old lady treatment of 42-year-old lady on treatment of RA with methotrexate and oral steroid presented with fever and cough for scanty expectation for last 3 weeks. Saturation was around 76 in ED. She has serum LDH grossly elevated. Identify the gross defect. Yes, it is. Pneumocystis carinii pneumonia. Fine. So 10 marks to group E. Team D, 58-year-old male presented with low-grade fever, cough, increasing breathlessness for last 2 years. On multiple occasions, his sputum AB and serenat are negative. Identify the gross defect. Team D. Team C. Team B. Team A. No. Team F. E. We are talking about Excel calcification in silicosis. Multiple small calcification. Now the last round is about the CT scans. So the cat will be in the chamber. You have to identify or guess the disease and look at the after looking at the CT. Team B, 19-year-old. Again, we will pass it out. There are no multiple choices. Okay. Team B, 19-year-old patient presented fever for a month. His peripheral smear showed plenty of blast cells and CT scan showed as below. Identify the gross defect. Guess the disease. Good. Invasive aspergillosis and there is. Can you tell the sign? Hello sign. Very good. 10 marks. Hello sign and invasive aspergillosis in a immunocompromised. 10 marks to team D. Team A, 54-year-old male presented with fatigability and decreased appetite. ACT abdomen is provided below. Identify the sign. Guess the disease. Team A. Identify this. Name the sign. Floating lily sign. Okay, fine. 10 marks to team A. Water lily sign and identify cyst of liver. Team F, 43-year-old male presented with fever for 2 months. All routine labs, X-ray, ultrasound abdomen and cultures were negative. Name the specific modality of this particular imaging. Name the imaging and guess the disease. Team F, PET scan. There is uptake in clean. So what are you considering? Clean. I think they have identified. Let's give full marks to team F. 10 marks. PET scan and splenic lymphoma, so there is increased uptake in the spleen. Direct question to team E. 18-year-old boy who is hypertensive, presented with seizure. CT brain is below. Identify the significant finding. Guess the disease. Team E. No. Team D. No. Team C. No. Team B. Team A. Huh? You are pretty close. Team F plus. Tuberous sclerosis. We are talking about the subcortical calcification tumors. You came pretty close, but sorry for that. Fine. Team D, 32-year-old patient had sore throat about a week ago, and now he is recovering from the sore throat. He presented with fever and pain in the left neck since last night. Name the syndrome. Team D. Various syndrome. Name the organism. Fusobacterium. 10 marks to Team D. Team C, 52-year-old diabetic patient presented with frequency and hematuria. Name the significant finding in the CT. Enterocytic pyelonephritis, most common organism is E. coli. 10 marks to Team C. Now the final marks.
Add and just let us know from 6, 5, 4, 3, 2.
Fine. So,
Take some bright chart. Write like A, B, C, D, E, and then.
Let us know the name of.
we will ABC.
They are also
Dr. Tejaswita, help. You can write it on your paper also, and you can. I think making quizzes are more difficult than participating. I had to study till 4:30 a.m. in the last night. Don't need it. Amsa, see, helping you. I invite Dr. Rajneesh to come on the dais. Thank you all.
We'll have the scores tallied and verified and also certificate setting. So very quickly, till we are getting this done, I would like to welcome some other people from AIIMS Bhopal who have joined us. So I would request Professor V.N. Mishra sir and Professor Seema madam to please also escort Professor Aneet Arora to the stage. Professor Aneet Arora is Professor and Head of Forensic Medicine and is officiating Executive Director with us today. So please welcome. I also request all our regional coordinators who are there with us in person, Professor Manoj, Dr. Manoj, Dr. Jasketan, Dr. Anupama, and Dr. Pratyusha, who also help fine tune and help us adjudicate the quiz. So please join us on the stage. I think Dr. Sagar, can you help us get certificates from 11 to 15? We'll start distributing in reverse order. Some certificates are ready from rank. Just कितने ranks लिखे हुए हैं? There's a bunch में ranks are here. Request maybe Dr. Prakash and Dr. Bibin to please help Dr. Sagar here. You can. So by the time we are finally and totally for the teams here, we have other teams. I'll request all teams. We can turn off the projector. Projector we can turn. So I'll quickly request team from Kolkata to please be on the dais. So I'll request, I think we'll also have our camera person ready. We'll put all the photographs here. Maybe you can join the team from Kolkata. So you can have a photograph team. I'll change this. It is only a photograph. I'll change Unfortunately, I mixed IGPMR with TGIMR. But anyway, so we had teams from Kolkata. They were winners of the regional round from region E1. I will request team from RIMS Imphal. You can just leave your certificates here and just take I think Imphal I've got the right ones. So requesting team from Imphal, Supratim Saha, Soumya Pratik and Neeram Register. Please give them a big round of applause. They were in our zone, they were winners of zone E3. I think they came after lots of odds. There were apprehensions whether this team will be able to participate. There were internet issues when we were having the regional rounds there. And they have come here from very far away. So, very now, request team from KMC Manipal. Dr. Aditi Rao. I think a big round of applause. Just to reiterate, they reached today morning. I thought probably they'll not reach. They missed their flight in Mumbai, then managed to reach a train station, catch a train, and reach early morning here. Probably their luggage is still in Mumbai. They are here. So anyway, very big round. I'll request team from GMC Surat. Please come on the stage, please. Yeah, I think Dr. Durai. So a big round of applause for each from him. There were winners of two rounds, W2 zone. West zone, and there were three West zones, so W2 zone.
There is a history attached to each team. There is a history with
There's the time. Great. Left where I got certificates mixed up. PGI Chandigarh, yeah. Can I request team from PGI Chandigarh? Okay, so anyway, I have to exchange the certificates of PGI Chandigarh with Kolkata. Names are similar, but so I think we'll pass them on. I think can I get the remaining certificates from? Yeah. So now we have teams from the top 6 ones. So I'll invite team from AIIMS Rishikesh to please come on the stage. Dr. Anjika, Dr. Santosh, Dr. JD. So a big round of applause for team from AIIMS. Secured 6 rank out of the teams here. So they were winners of one of the North zone, I think N3 zone, which consisted of Uttarakhand and Uttar Pradesh. Next, I'll request team from MGM Indore, Dr. Aanchal Goyal, Dr. Avinash Vishisht, and Dr. Varnan Chandravanshi. So again, a big round of applause to team from MGM Indore. They were winners of the central round zone, which consisted of MP and Chhattisgarh when we had our regional schools. Next, at the 4th rank, I would call upon team from SKIMS Srinagar, Dr. Mir Tehleen, Dr. Uzair Bilal, Dr. Sheikh Mohsin Hassan. So, again, a big round of applause for team from SKIMS Srinagar. Again, they have come from very far away, and I think one of them is going to recite as a poem. Somebody was doing Urdu poetry. Please prepare.
Last week.
Maybe ask them what to do. Only one person. So for the 3rd rank, I request team from
Other fond of this type of question in our states also. My competition. We have prepared a very studies almost 5 to 6 common.
So we'll call for team from TMC Vellore. They also come from far away, Tamil Nadu. So Dr. Namrata, Dr. John,
Very active in the Kolkata because currently AP is from our school. Next AP is going to happen in Kolkata. This time is happening in Delhi. Next time after Delhi it will be in Kolkata.
Okay, great. So there will be one more book for you to read, but it's okay. Public round of applause.
He is one of the winners, and he is one of them. From
So now I'll call teams from Maulana Azhar, New Delhi. They stood second. What was their score?
Similarly, the
100.
brand available at JB
Dr. Namita George,
question was tough, but
Dr. Arun,
question was like
Dr. Sudhirta.
question was
So, better. So a big round of applause. Team who scored second. Team from Maulana Azhar Medical College, Delhi. So, very big round of applause to team who stood first. This is team from AIMS Nagpur. There was winner of W3 round. W3 zone. Dr. Snenendu Haldar, Dr. Priyadeep, Dr. Prashant.
More responsibility to be in Nagpur.
They also had a so a very big round of applause to them. They also get a trophy. You can hand over the book to me, and you can all three can join to take the trophy. So I think you can keep this trophy in your department. So photos done. One more photo, Lily. One more photo. All the three, you can join in the center and collect the trophy. We'll have another. So, yeah. We'll have. There are few more before we call everyone. Just like, I think we have one next set of certificates. So, we this next set of certificates is for the regional coordinators who are already there with us on the stage. So we have others will be sending their certificates. So we have number of faculty members. So very quickly, I think so Dr. Manuel Sarkar from AIMS Deoghar. He coordinated for the E2 zone, so unfortunately make it for the
He has to send the two capital flights.
Yeah. He also had a long journey. I think he traveled from Deoghar to Patna, and then there was a flight which was cancelled, and then to Delhi, and then another flight was cancelled. 40 hours, and then eventually Dr. Anupama Behra from
there was
Bhubaneswar.
7 to 8, and they have selected 3 of us. They told us to submit documents and they
Dr. Jadketan from AIMS Raipur. Dr. Pratyusha from AIMS Mangalagiri. So, I think we'll have a group photograph at the end, I think, from this side to this side. So by the time, everyone can come on the stage. So by the time people are arranging here, I'll request Professor Dr. Anit Arora ma'am to just say a few parting words before we move for lunch. So, ma'am.
Dr. Rajneesh. This was wonderful to join in, and I found the first few rounds extremely creative in their how the questions were put, how the answers were, and I think this is really nice, and I enjoyed being part of this. And Dr. Rajneesh is very versatile, very efficient, and very extremely respected person in this campus. But nice to see him in this mode too and making all these beautiful questions with his team. Dr. Sagar has been wonderful in going through the whole thing as a quiz master. And we've been holding forensic medicine quiz too for a few years annually at national level, forensic quiz where we have 30, 40 undergraduate quiz, not the postgraduate quiz. And we realized that it's like quite a tense thing to make the questions and make it appropriate A, B, C, D. And I don't know whether it was.
I had to study till 4:30.
But this quiz everybody seems to enjoy, and nobody was too relaxed. I mean, nobody was too anxious or panicky, or everything was quite very smooth, very nice. And today I'm representing director sir who is not in town. So I'm happy to represent him and be part of this, and I'm really lucky to have a Sunday with such renowned people and from all over the country and from all aims and beautiful institutes which we respect so much, and nice places from neighborhood or somebody coming 40 hours journey to be here. Very nice to be part of this group. Thank you so much, Dr. Rajneesh.
I think by the time everyone is coming on the stage, I'll also request some other hidden faces and individuals behind the quiz. So Dr. Yasmi, who helped us with most of the preliminary rounds and also the regional rounds. Dr. Mahadev, I think he left somewhere for the ward. Our residents who helped coordinate various aspects of this event. So I'll request everyone to please come on the stage and stay on the stage. Dr. Shaurya, Dr. Prakash, Dr. Bipin, Dr. Adarsh, Dr. Maya, and who else is here? Dr. Shubham. Yeah, please come over on the stage.
All residents on the stage.
Please come over on the stage and request everyone. Dr. Sanjay, Dr. Sanjay, they help with various aspects of the quiz. So please join us, and this way we can arrange ourselves for the album photograph. And now I'll also request all the team members. We also have a number of other individuals who supported us in the process. Mr. Apur from Department of Medicine, Mr. Ajay Katoj, Mr. Ajay from the department who have been running around, and Dr. Sukumar, Dr. Abhishek Singhai, faculty members in the department who helped us with the workshop yesterday. So please come over to the stage along with all other participants so that we can arrange for a very nice group photograph. Yeah. Please. Dr. Sagar, yeah. I saw him, he drank only half a bottle of water. So please, requesting all teams to please come over to the stage and we can arrange ourselves in a group photograph.
ठीक है सागर got sent.
Is it supposed to sandwich cherry on top?
I think so.
इंप्रेशन करना है कि एक्सप्रेशन?
Smile करना है.
चीज बोल
So I think we'll all move to Finland.